Palestinian Health Minister says a ceasefire deal is vital for medical teams to administer polio vaccines to Gazans. 1.6 million jabs are set to be provided to the enclave with the help of the World Health Organization. It's hoped a campaign to provide 2 rounds of a polio jab will be launched at the end of August across the Strip.
We had 3 suspected cases of polio, and samples were taken from the 3 patients who were babies. The samples were sent to Jordan for testing, and unfortunately, there was 1 positive result in a 10-month-old baby who had not had a chance to get vaccinated. This has ended 40 years Palestine being free of polio. We were the first country in the Eastern Mediterranean to be free of this disease.
Well, as we were hearing from Ube, the Israeli army says it has retrieved the bodies of 6 hostages from the southern Gazan city of Khan Yunis. The military says they were among the people abducted on October the 7th. Well, let's get the latest from the ground with Ashraf Shannon, who's also in Khan Yunis. Ashraf, what more can you tell us about the bodies of these hostages that were retrieved? What more do we know? I'm afraid it looks like we may have lost Ashraf on that, but I can tell you once again, 6 bodies of hostages retrieved by the Israeli military from Khan Yunis. They say they were acting on intelligence that they had received. All right, well, more than 10 months of Israel's war on Gaza has taken its toll on the health and well-being of more than 2 million Palestinians, and disease continues spreading rapidly through the population of the Gaza Strip. There are growing fears about the spread of polio in the enclave after vaccination rates fell from 99% before the war to around 90% today. Ashraf Shannon has been tracking developments.
Piles of rotting garbage litter the footpaths in Gaza, and sewage flows freely through the streets. The UN says more than 1.7 million people have been infected with communicable diseases in recent months, 71,000 of them suffering with hepatitis A, reflecting the dire state of water and sanitation in the Strip. On Friday, the enclave's first case of polio in 25 years was detected in a 10-month baby.
The polio virus has resurfaced again because of the destruction of the sewage system and water pollution. The spread of polio infections will be catastrophic. Polio symptoms may resemble the flu or meningitis and could lead to permanent paralysis.
Access to water and sanitation are internationally recognized human rights derived from the right to an adequate standard of living. Thousands of Palestinian children are currently suffering from skin rashes and gastrointestinal symptoms due to the lack of clean water.
We call on people around the world to help us. My daughter is sick and she suffers from a bad skin rash, and doctors haven't been able to treat her. Our children are suffering from various diseases, and I have to come to the hospital at least 3 times a week.
My son became very sick during the war and suffers from malnutrition. He needs urgent medical care outside Gaza, but the crossing is closed. I'm worried that I might lose him.
As the international community watches on, Gazans are being overwhelmed by sickness, and there is no end in sight.
Our children are getting sick because of the war and because of the unsanitary conditions in the tents, and we can't find medications to treat them.
Surrounded by destruction, disease, and death, they are crying out for help. Health officials say that urgent measures are needed to stop a full-blown health catastrophe in the Gaza Strip. Ashraf Shannon, TRT World, Gaza.
Well, I'm pleased to say that we do now have Ashraf Shannon from Khan Yunis inside Gaza. And Ashraf, I was trying to ask you before when we lost you about what more we know with regards to the bodies of these 6 Israeli hostages who have been in Gaza, it's understood, since October the 7th, after they were taken captive by Hamas. What more do we know about who they were and how and where they were found?
Well, Charlotte, according to the Israeli military, initially they said one body of a dead hostage was found last night, and then they said 5 more bodies. So in total, 6 bodies were recovered from a tunnel somewhere in Khan Yunis, according to the Israeli military. And the Israeli military also says that those hostages died in captivity. They weren't killed and brought to Gaza. Apparently, they died in captivity. Hamas's military wing, the Gazan brigades, repeatedly said that many of those Israeli captives or hostages died because of or were killed because of the ongoing Israeli attacks throughout the Gaza Strip. So it's not a surprise if these 6 Israeli hostages were killed by Israeli fire, similar to what happened in previous incidents or attempts to rescue hostages from the Gaza Strip, Charlotte.
And meanwhile, there have been some humanitarian missions. A UN convoy has visited the Strip to try to deliver essential fuel, but they've been saying that what they're able to do is nowhere near enough and that hospitals are again having to postpone and cancel life-saving operations.
Well, yes, we have to understand that since day one of the war, the attacks on the hospitals were systematic by the Israeli military. Israel wanted to paralyze everything in the Gaza Strip, including the health sector. Hospitals in Gaza, throughout the Gaza Strip, are functioning partially, including this one, Nasser Hospital, where I'm standing right now in Khan Yunis. And they have acute shortage in medicines, surgical supplies, and their staff is super exhausted by non-stop work for more than 10 months now, and Israel continues to hamper the delivery of supplies to hospitals, including fuel. A similar incident happened a few days ago in the northern Gaza Strip hospital of Al-Awda, where they are running out of fuel, and they had to stop dozens of surgeries there, Charlotte.
And what about the state of the ceasefire negotiations? Do Gazans have any hope left that a deal will be struck? What are their thoughts on them, on Blinken's visit to the Middle East? How optimistic are they?
Well, for Palestinians in Gaza, hope is the only thing that remains that keeps them alive. You know, they have lost everything. They lost their livelihoods. They lost their loved ones. They lost everything. They have nothing left right now except hoping, you know, for a break into these ceasefire talks. And some here believe that the more Israel intensifies attacks, the closer ceasefire, talks are edging to fruition. This is what most people believe.
All right, Ashraf, it is very noisy where you are, as you are just right by a hospital, but we really appreciate your updates and your analysis for now, though. Thank you so much. All right, well, for more on the race to curb the spread of polio in Gaza, let's bring in Dr. Hamid Jafari. He's the Director for Polio Eradication for the World Health Organization in the Eastern Mediterranean region, and he joins us live from Amman in Jordan. Thanks for speaking to us on the News Hour. Just really briefly, if you would, remind us what exactly polio is, how it affects people and how it spreads.
So polio is a virus that infects those who don't have immunity to polio, and a fraction of people who get infected with polio virus develop paralysis. It's called poliomyelitis. This is an infectious disease that spreads through what we call fecal-oral transmission. So that fecal contamination, directly person-to-person transmission, is the predominant route. And as you can see these images from Gaza, there is so much exposure to sewage that the children are at high risk of extensive exposure to polio virus, because the virus is excreted by infected individuals in their feces, and it's the predominant route of transmission is fecal-oral transmission. Basically, the paralysis is permanent. There is no treatment to cure the paralysis because the nerve cells are destroyed by polio virus. It can only be prevented by vaccination.
OK, thank you for that. In 2022, the WHO said that for Gaza, the polio vaccination rate was 99%, and it's now fallen to around 90%. I just wonder, that is quite a big drop in quite a small space of time. Can you explain to us, obviously the war's been going on, but how has it dropped so quickly?
Well, the immunization coverage with the polio vaccine was really very high in Gaza. But after the start of the war, many of the hospitals that provide services are no longer functioning. Less than half of the 107 primary healthcare facilities that provide vaccination for children are no longer functioning. Children and families are getting extensively displaced and are not able to consistently get healthcare. Those are the obvious reasons why the vaccination rates have dropped, and they're obviously dropping most in the youngest children who get their childhood vaccination in the first 6 months of their life, the initial doses for polio. So because of the disruption of health services, vaccination services have been also severely affected. And children now are living in conditions that are highly favorable for poliovirus transmission. I mentioned the exposure to sewage, but also overcrowding, displacement, constant move, malnutrition. All of these factors contribute to efficient poliovirus transmission.
So we're hearing that 1.6 million doses of the polio vaccine are being made available. I understand they're not in Gaza yet. I suppose, how does one even begin to organise an effective immunisation campaign in the circumstances that you've just described in Gaza, with people moving around from pillar to post, never in the same place? As you say, healthcare services significantly disrupted. How is that even going to be possible to organise?
So the Global Polio Eradication Program has extensive experience in vaccinating children in settings of conflict. So the program knows how to do what we call micro-planning to, for a given period of time, make a very clear and detailed plan of where the families and children are and what would be the modalities to provide the vaccine, whether it's through house-to-house vaccination where appropriate, or through reaching out to community centers, to health facilities, setting up temporary fixed sites. So the plan is very, very appropriate to where the children are in a very specific period of time. And the campaign is most successful when it is completed everywhere in a short period of time, so that you're not staggering the campaign. Otherwise, children are constantly moving. Unvaccinated children come to the areas that have already been vaccinated. So this all has to be done in a short period of time. So the program knows how to plan to deliver the vaccine. Of course, what is not in the control of the program is the environment in which this is implemented in terms of peace and security. And that is why the polio program has been involved in negotiating days of tranquility, corridors of peace, cessation of hostilities, and ideally a long-term ceasefire. So the plans are ready for the implementation of the first vaccination campaign at the end of August. We are now in a stage of coordination where the authorities are coordinating to see how best the hostilities can be stopped and an environment could be put in place whereby health workers can move, vaccines and supplies can move, and most importantly, communities can come to health facilities to get their children vaccinated and protected against polio.
Just really, really quickly, because we're out of time, we've already had a confirmed case. Do you think this programme can be implemented fast enough before we see more children contracting this terrible illness?
We could have prevented this case of paralysis if we had detected the virus earlier and started sooner, but the surveillance system to detect polio virus was also disrupted as a result of war. So in some ways, we have already failed a child and potentially more children. So the earlier we can get started in vaccinating the children and implement the vaccination campaign rounds where we need to reach more than 90% children, the sooner we'll be able to stop this outbreak, protect more children, not only in Gaza, but also in Israel, in the West Bank, and in surrounding countries.
Dr. Hamid Jafari, thank you so much for your time, and I wish you and your colleagues the best of luck with that immunisation programme.
Thank you.